Good morning again. Welcome to a CCPU webinar. We will be displaying English-Spanish presentation on screen. To access this presentation in Chinese, please visit ccpuhealth.org/resources, which will be on the main menu of the website. There will be a download section with both English, Spanish, and Chinese slide version in PDF form to download. As I said, thank you for joining us today. I'm Horst Turner, a family child care provider from Stanislaus County. More in a moment on me and other healthcare leaders. Again, I'm Horst Turner, family child care provider and CCPU member from Stanislaus County. I'm also a chair of our CCPU Health Care Trust, and I'm excited to welcome to you this morning. Today is the first of many webinars and information session about our groundbreaking CCPU health benefit. We will review how the plan works to review specific scenarios that apply to most providers, and we have time for questions and answers at the end. As I said earlier, we will have many more sessions regarding the information you received today. And there's a phone number on our website if you have any questions and you'd like to get answered or addressed in that way as well. The CCPU Board of Trustees consists of 6 representatives appointed by the local unions. Yvonne Cottage, Secretary, Patricia Moran, Trustee, Jackie Galliano, Trustee, Joe Scala, Trustee, Rico Mendez, Trustee, and myself, Horst Turner, the Chair. Now, I'd like to introduce Max. He has a few words to say and how we got here.
Thank you, Horace. Good morning, sisters and brothers. My name is Max Arias, CCPU Chair and Chief Negotiator. We're here today to discuss our new healthcare trust, something I'm really excited to be talking about. Why am I excited, you ask maybe? Well, because this is something that you, providers, you made it happen. We're only here today discussing this because of the tireless work of providers who made sure the state heard our demands. And they really heard, as I know we were all so loud. When we started bargaining for our first contract, it was clear that we needed to organize to win for many things, but we also needed to win healthcare for all providers. And all throughout bargaining, we never gave up on our just fight for access to quality, affordable healthcare for all providers. That led to that JLMC, and we still never gave up and kept surfacing our demands. Providers shared their stories of going without healthcare when they got sick, which is unacceptable, or having to go to Mexico to be treated for a chronic illness, or providers being forced into debt to pay for medical bills, or just having to close the doors. Many of you on this webinar probably can relate to that. That is just unacceptable. So the pandemic, of course, put a spotlight on how critical healthcare is to our lives. Providers put their lives on the line as they kept their doors open when the world just shut down. And you were the only ones educating children in person. And providers continue to be heroes as you continue to navigate COVID-19. Just the daily healthcare challenges of working with your children is big. But one thing I know is that all of you, providers, you rose to the challenge. And in the fight for healthcare benefits, providers, all of you, showed how powerful we are when we come together and make our voices heard. You organized other providers, mobilized in Sacramento, made noise, and did that throughout the whole state. We let decision makers know we'd keep organizing, escalating, and disrupting until we won. Alone, we're strong. Together, we're unstoppable. Just being here right now shows the power of our union and our voices. I am so proud of what CCPU has accomplished and look forward to what we do next. But today, we're here to learn about our exciting new healthcare trust. And to help us do that is Sister Patricia Moran. Patricia, over to you.
Thank you so much, Max. My name is Patricia Moran. I am part of I'm a trustee, and I'm from Santa Clara Santa Clara County. Today's presentation will be an overview of the new CCPU Health Care Fund. Key rules for benefits that are available for every eligible provider. Who is eligible and how to become eligible? And finally, how to get updates about the latest from the new CCPU Healthcare Fund. We have also included a few examples of how it works for different scenarios. Not every provider has the same situation, but there's a way for everyone who cares for a subsidized child to get benefits here. It is important to note that we don't have all the details for you yet on how the CCPU Healthcare Fund is going to be administrated. But we wanted to share with you where we are so far, so that you can make the right decisions about what health plan to enroll in during the open enrollment period for 2023. As you know, CCPU won $100 million annually from the state of California to help for eligible healthcare providers to reduce or eliminate healthcare expenses. It is important to know how these benefits work with your health plan. They do not replace your health plan. The CCPU Health Care Fund will cover benefits for eligible providers for expenses such as health plan out-of-pockets, including medical copays and deductibles, pharmacy copays and deductibles, and some health plan monthly premium expenses. One of the great advantages of the CCPU Healthcare Fund, the benefits are available for they're eligible providers regardless of what type of qualified healthcare, for everyone eligible provider regardless of what type of qualified health plan they have. Benefits are available for people in Cover California, Medicare, and employer-based plans, Medi-Cal, and for those who are not insured, we can also help you to enroll in qualifying health plans. We are working hard on getting the program launched with our vendors. We are going to start working on this during the spring, but the good news is that the benefits will be effective for covered services you receive on January 1st going forward. In other words, this means that if you meet the eligibility requirements, you will be able to submit expenses for reimbursements from January 1st, 2023 and forward. Please sign up on the website to get the latest information and the details on when you can submit your applications, as well as you can start processing requests for reimbursements. It is important to understand that the benefits that we are describing are not traditional health plan, but it is a reimbursement plan. This is important. So you do not need to cancel your health plan. You sign up for our health plan and our health care fund to help you pay for a share of the cost of your health plan. Before we start to talk about the overview of how the CCPU Health Care Fund works, we want to share a few definitions of some of the terms that we will be using in the next slides. Definitions. Prime. This is going to be the monthly paid by the provider that is paid regardless if you used your plan or not. Cover health plans expenses, the dollars paid by the provider for the ones that they need to pay for the health plan of using such as deductibles, co-payments, and co-insurance. Permissible medical expenses. Expenses related to healthcare that are not part of the plan. Only benefit for medical. Examples. Vision, dental, pharmacy, and medical devices. Over-the-counter therapy devices.
Now, it is my honor to introduce Rico Mendez. Thank you.
Thank you so much, Patricia. Muchas gracias a ustedes. It's really wonderful to be here with all of you today. Over 700 of us on this call together. My name is Rico Mendez. I'm the Chief Elected Officer of SEIU 521. I'm the Secretary Treasurer of CCPU, and I'm also a trustee on this amazing healthcare trust that we're all starting together through our union. So I'm going to present some key information for benefits. A key rule for CCPU Health Care Fund benefits is that benefits are only available for eligible providers after you apply for all federal assistance available and enroll in a qualified health plan. What does it mean to enroll in a qualified health plan? Well, for example, if you qualify for Medi-Cal, that's great. Continue to enroll in Medi-Cal. So if you qualify, you enroll in Medi-Cal first. That's a version of coverage that you can get through our state. If you qualify for a subsidized plan on Covered California, then you must be enrolled in what's called a subsidized silver level HMO plan. Once again, that's silver level HMO plan, but that's a really good thing. You'll hear soon why. If you have a second job and that job offers health insurance, you must enroll in that plan. If you're eligible for Medicare, you must be enrolled in Medicare. That's for people over 65. And if you're currently uninsured, then we can help you in enrolling in a qualified health plan. Let's go on to the next slide. How do you become eligible for CCPU healthcare benefits? There are 3 steps that we will review on how you become eligible for benefits. Number 1, you must be paid for work with a subsidized child. Once again, you must be paid for work with a subsidized child. Second, you must enroll in a qualified health insurance plan. And third, you must enroll in the CCPU Health Care Fund by completing the CCPU Health Care Fund application. The first criteria of being paid for work with a subsidized child is determined the following way. Eligibility will be determined in 3-month blocks. The initial eligibility rule requires that you are paid for work with a subsidized child in 3 out of 6 months. To have ongoing continued eligibility, you must be paid for 1 out of 3 for work with a subsidized child. You can refer to the ccpuhealth.org website for details on how paid work eligibility is determined. Next, the second criteria for eligibility is enrollment in a qualified health plan. As we previously mentioned, a qualified health plan is based on maximizing the federal assistance available to you. If you qualify for Medi-Cal, you must be enrolled in Medi-Cal. If you qualify for Covered California subsidy, you must enroll in a silver level HMO Covered California plan. And if you have a second job that offers health insurance, you must be enrolled in that plan. If you're eligible for Medicare, you must be on Medicare. And if you're currently uninsured, we can help you with the enrolling in a qualified plan. The third and final criteria for becoming eligible for healthcare fund benefits is to enroll by completing a CCPU Health Care Fund application. The applications are coming soon. They will be available online and on paper starting in early January 2023. And as a reminder, sign up on the website to get updates and communication about when applications become available. Once again, please sign up on the website to get updates and communication about when applications become available. This is a wonderful opportunity for providers to make sure that you have healthcare coverage through CCPU and our partnership with the state of California. I'm really excited about what this means for providers to have this type of coverage and access. And with that, I'm going to pass it over to my fellow trustee, Joe Scala.
Thank you so much, Rico, and good morning, everyone. As is the case with my fellow trustees and Max and everyone that's here to speak with you today, I'm very, very excited to present to you, our progress and on these benefits. So, for my part today, I will be covering what specifically the benefit looks like for those of you who would enroll through Covered California. So for those providers that are enrolled in Covered, the Health Care Fund covers up to 100% of your health plan cost. This includes reimbursement of health plan out-of-pocket expenses such as co-pays, deductibles, and co-insurance, up to $8,750 per year, as well as reimbursement of 100% of your health insurance premium cost on a qualified health plan, which, as Rico just mentioned, would be a silver level HMO plan. Now, it is important to note that for those providers on Covered California, and I'm sounding like a broken record here, but benefits are only available if you are on a silver level HMO plan. As a reminder, if you have a second job that offers health insurance, you are not eligible for benefits from the CCPU Health Care Fund via a Covered California plan. You are only eligible via that second employer's health insurance plan. Okay, so the next couple slides, we're going to go through an example of a provider on Covered California and how they would access and receive their new healthcare fund benefits. So we have Carlos here. Carlos was paid for work with a subsidized child in the months of April through September. Carlos did not get paid for any work with a subsidized child in the months of October through December. As a result, he is not eligible for the CCPU fund for April through June. Carlos did not get paid for any work with a subsidized child in the months of January through March. As a result, he is not eligible also for the CCPU fund from July through September. Carlos did get paid for work with a subsidized child in the months of April through June. As a result, he is eligible for the CCPU fund from October to December. Carlos then therefore enrolled in a Covered California Silver HMO plan. Carlos submitted his fund application to receive benefits. So we have just covered Carlos's story here. Now this slide highlights his eligibility to participate in the CCPU Health Care Fund. Carlos is going to receive out-of-pocket benefits of up to $87.50 per year, as well as 100% of his premium cost will be covered during his eligibility periods of January through March and October through December. Now, one of the nice features of our program is that the out-of-pocket reimbursement, Even though Carlos wasn't eligible for the entire year, as you saw in that example, I mean, it was a little bit confusing, but hopefully that's, one of the takeaways is that he didn't have full eligibility for the year, even though he wasn't eligible for the entire year. If he had a big hospital bill in one of the months that he is eligible, he still can access the full $8,750, the full $8,750. And it's also important to note about that amount is that the $8,750 is the maximum a person would have to pay out of pocket for this plan, which is 100% covered by the benefits of the CCPU Health Care Fund. So moving on, we've sort of put this into a chart. The chart demonstrates that Carlos was eligible for the CCPU Health Care Fund in the months of January through March and October through December, which is highlighted there in green. Okay. Carlos will receive out-of-pocket benefits of up to $8,750 per year, as well as 100% of his premium costs will be covered during his eligibility periods of January through March and October through December. These benefits are highlighted in yellow. So you can see that there's the overlap between the CCPU eligibility periods and the time during which, during the time of the year during which benefits are available to Carlos. Okay, so this concludes my portion of the presentation. And with that, I would like to hand it over to my fellow trustee, Yvonne Cottage, to discuss benefits through Medicare. Thank you, and take it away, Yvonne.
Hi, thank you so much, Joe. Hi, everybody. My name is Yvonne Cottage, and I am a family child care provider in the city of Lancaster. And it is my privilege to be the secretary on the Board of Trustees for your healthcare fund. And I'm going to go over some of the Medicare information. So for those providers that are on Medicare, the CCPU Health Care Fund benefits include reimbursement of health plan out-of-pocket expenses up to $8,750 per year. Again, the health plan out-of-pocket expenses includes co-pays, co-insurance, and deductibles for medical and pharmacy expenses. Medicare expenses also include reimbursement of the Medicare Part B premiums up to $164.90 per month, and reimbursement of Medicare Part D premium up to $50 per month. For most providers, this covers the full coverage to you based on the 2023 Medicare costs, Part B and Part D. Our next example is a provider named Rose, who is on Medicare and is accessing the new CCPU Health Care Fund benefits. Rose was paid with a subsidized child in the months of April 2022 to June 2023. So as a result, she's eligible for the CCPU Health Fund for the entire year. Rose submitted her fund application to receive the benefits, and Rose enrolled in Medicare. Now, we just covered Rose's story. She was eligible for the entire year. Her out-of-pocket benefit is $8,750. Part B, $164.90 per month, and Part D, $50 per month. So her coverage was for the entire year. Now, covering Rose's story, you see the slide highlights her eligibility to participate in the CCPU Health Care Fund. Rose will receive out-of-pocket benefits of up to $8,750, as well as the premium reimbursement for Part B of up to $164.90 per month, and for Part D of up to $50 per month. The chart demonstrates that Rose was eligible for the CCPU Health Care Fund the entire year, which is highlighted there in green. Rose will receive the out-of-pocket benefits of up to $8,750, as well as the premium for Part B up to $164.90 per month, and for Part D of the $50 per month. the entire year, as you see there in yellow. So for those providers that have a second job that offers health insurance from that employer, the CCPU Health Care Fund benefits cover reimbursement of health plan out-of-pocket expenses of up to $8,750 per year and reimbursement of your cost of premium up to $100 per month. It's also important to note here that if you do have a second job that offers health insurance, you must be enrolled in that plan to receive healthcare fund benefits. You will not be eligible for healthcare fund benefits if you enroll in covered California. If you have access to an employer plan as a dependent through your spouse, you can enroll in either the employer plan or a qualified covered California plan and receive healthcare fund benefits. Our next example is Jade. She's a provider who has a second job and is getting health care on a medical plan from her employer. Jade was paid for work with a subsidized child in the months of April 2022 to June 2023. As a result, she is eligible for the CCPU Fund the entire year. Jade submitted her fund application to receive benefits. Jade enrolled in the employer plan. So Jade is eligible the entire year. The out-of-pocket benefit is $8,750. And the coverage, she's covered for the entire year. And the premium reimbursement is $100 per month of premium cost during the eligibility period. So we've just covered Jade's story. And this slide highlights her eligibility to participate in the CCPU Health Care Fund. Jade was eligible for CCPU Health Care Fund the entire year. Jade will receive out-of-pocket benefits of $8,750 as well as premium reimbursement of $100 per month. Now this chart demonstrates that Jade was eligible for the CCPU Health Care Fund the entire year, which is highlighted in green. And Jade will receive the out-of-pocket benefits of up to $8,750 as well as premium reimbursement of up to $100 per month for the entire year, as shown in yellow. Now, it's my privilege to hand it back over to Horace, who will go on and continue explaining. Thank you.
Thank you, Yvonne. For eligible providers that are on Medi-Cal, and the CCPU Health Care Fund has a different benefit because Medi-Cal often pays 100% coverage for premiums and out-of-pocket already for Medi-Cal recipients. The healthcare fund for providers on Medi-Cal is $100 per month for permissible healthcare expenses. What are permissible healthcare expenses? These include such things as braces, glasses, aspirin, etc. It is important to note that the permissible healthcare expense benefit is only available for those providers that are on Medi-Cal. It is not available for providers that are on one of the other qualified health plans. Our next example provider is Eduardo, a provider who is on Medi-Cal. Eduardo was paid for work with subsidized child in the months of April 2022 through June 2023. As a result, he is eligible for the CCPU Fund for the entire year. Eduardo submitted his fund application to receive benefits. Eduardo enrolled in Medi-Cal. We have just covered Eduardo's story. This slide highlights his eligibility to participate in the CCPU Healthcare Fund. Eduardo was eligible for the CCPU Healthcare Fund the entire year. Eduardo will receive $100 per month for permissible expenses. The chart demonstrates that Eduardo was eligible for a CCPU Health Care Fund the entire year, which is highlighted in green. Eduardo will receive $100 per month for permissible expenses for the entire year, as shown in yellow. For those providers who are uninsured and do not have health insurance, the healthcare fund can refer to you an open enrollment specialist. Again, the healthcare fund can refer to you an open enrollment specialist who can help you find an appropriate qualified health plan. Based on what the health plans you are enrolled in, you receive a CCPU Healthcare Fund benefit we just reviewed. With the healthcare fund assistance, every eligible provider has access to affordable healthcare with up to 100% coverage. Our final example is more complicated, but we thought it'd be good for us and a good example to share with you. In this example, Yvonne started a subsidized silver HMO plan with Covered California, and then moved into a Medi-Cal plan. Yvonne was paid for work with a subsidized child in the months of April 2022 and June 2023. As a result, she was eligible for the CCPU fund for the entire year. Yvonne had decrease in income that allowed her to enroll in a less expensive Medi-Cal plan mid-year. We have just covered Yvonne's story. This slide highlights her eligibility to participate in the CCPU Health Care Fund. Yvonne was eligible for the CCPU Health Care Fund the entire year. Yvonne will receive out-of-pocket expense benefits of up to $8,750 and up to 100% reimbursement of premium costs of the months of January through June. When Yvonne moved into Medi-Cal plan in July, she received up to $100 per month from July through December for permissible healthcare expenses. The chart demonstrates that Yvonne was eligible for CCPU Health Care Fund the entire year, which is highlighted in green on Colored California. Yvonne will receive out-of-pocket benefits of up to $8,750 and up to 100% reimbursement costs for the months of January through June, shown in blue. When Yvonne moved into Medi-Cal plan in July, she will receive up to $100 per month from July through December for permissible healthcare expenses, shown in orange. So with that demonstration, I'd like to take a moment in time to reintroduce Yvonne. And Yvonne's going to go through a short presentation about the union. Yvonne?
Thank you so much, Horace. So for 17 years now, family child care providers have fought for you to have the right to unionize. At the end of 2019, Governor Newsom signed AB 378, Building a Better Early Care and Education System Act, which allowed 40,000 child care providers to vote and become a union. And 97% of California's family child care providers voted yes to unionizing. Congratulations. This win gave family child care providers the right to negotiate with the state for improvements to the early childhood education system. Our first contract agreement was a $1 billion agreement, and you guys all deserve more. I'm here to ask all of you providers who are not a union member yet to come and join us. You should join the union because there's so much more that you guys all deserve and so much more that needs to be changed, to be fixed, and to be corrected, such as rate reform, meaning we should be getting paid on the true cost of providing childcare, and reimbursing providers based on enrollment and not on attendance, and eliminating those parent fees permanently. Let us not forget about the retirement fund. We need every provider in California to join our union, Childcare Providers United. You'll see a link in the chat. Please feel free to go ahead and click on that to get more information and go to our website. We need all of you guys to join us when we have actions at the state capitol, so we can show how united and how powerful we truly are. When providers are organized and use their collective power, we can force all of those decision makers, from the governor to the legislators to wealthy corporations, to pay more attention. We need all of you providers to join us and to use your voices on the steps of the state capitol, so that decision makers can not only see us, but hear us. When we go to Sacramento, we make our presence known. When we fight, we win. We make things happen by working together and by being united. So far, we've won a lot of things, such as our first COVID agreement that paid 14 days, as well as our second COVID agreement that paid 16 days. Our funds for mental health, our supplemental pay, our $40 million training fund, an infrastructure block grant, and family childcare providers had never been included in this grant before. And of course, our healthcare fund. This is why we unionize and why we fight for our rights and all those benefits that we deserve. We need you all to join us today and stand side by side us demanding this change. Again, if you haven't clicked on the link, you can go ahead and take your phone and take a picture of that QR code that's on your screen right now that will also take you directly to our website. If you have any questions, please go ahead and put them in the chat, along with your phone number and your email and your address. So go ahead and click on the chat, put your phone number in there, your email and your address, and we'll have an organizer contact you. And remember, when we fight, we win. Thank you. Now back to you, Horace.
Thank you, Yvonne. And just to remember, wow, what a victory it was when we became a union, and what power we have to sit at the table. So I'm just ecstatic every time I hear that message, and knowing that with the numbers, we can achieve anything. Thank you, Yvonne, again. So to recap, the CCPU Fund, Healthcare Fund benefits discuss: if you're eligible provider and enrolled in Medi-Cal, you will receive up to $100 for permissible health expenses. If you are eligible provider and enrolled in Cover California, you will receive out-of-pocket benefits of up to $8,750, as well as 100% of your premium costs covered. If you're eligible provider and you're enrolled in Medicare, you will receive out-of-pocket benefit of up to $8,750, as well as a premium reimbursement for Part B of $164.90 per month, and Part D of $50 per month. Great benefits. If you're eligible provider and enrolled in an employee spouse plan, you receive a reimbursement of health plan out-of-pocket expenses up to $8,750 per year, and reimburse of your cost of premiums up to $100 per month. Eligible providers will be able to access their benefits in two ways. This includes swiping a debit card that will be mailed out to you or submitted a request for reimbursement where the providers will receive a check or electronic reimbursement. In either case, you will need to provide backup paperwork so that the Health Care Fund can validate its reimbursing for qualified expenses. Our website and our welcome material will have specific details on how that will work when we go live. If you need assistance with enrollment in the healthcare plan, we have resources available for you. Whether you're on Medi-Cal, Medicare, Cover California, or your second employer, or you just don't have health insurance, you can visit www.ccpuhealth.org/help/enrolling for a list of those resources. In the following slides, we will provide information on frequently asked questions. In this summary, so frequently asked question number 1, does the fund provide health insurance? The answer, no. The CCPU Fund does not provide health insurance and is not a health plan. It is a reimbursement plan that works in conjunction with the health insurance coverage. In fact, you cannot enroll in the CCPU fund unless you have a qualified health insurance plan. If you're not insured, you will need to enroll into a qualified health insurance plan available to you. See frequently asked question number 7 for enrolling in a qualified health insurance plan. Frequently asked question number 2, are the benefits from the CCPU Fund taxable income to the provider? Answer, the reimbursement of the health plan out-of-pocket expenses and reimbursement of your insurance premium costs on qualified health plans are not taxable income to you. Any cash benefit that is not for reimbursement of medical expenses will be taxable. Frequently asked question number 3. What are the benefits available to Medi-Cal enrollees? Answer, the providers that are on Medi-Cal are eligible to receive a benefit of $100 per month to reimburse for permissible healthcare expenses. Question number 4, what benefits are available to providers that are covered under an employer health insurance plan as an employee? Answer, the providers enrolled in an employer group health insurance plan and the employee are eligible for 2 types of benefit, up to $8,750 in reimbursement of the health insurance out-of-pocket expenses and up to $100 per month in premium reimbursement. Number 5, what is the benefit are available to providers that are covered under an employer group health insurance plan as a spouse or a child, a dependent of the employee? Well, providers are enrolled in an employer group health insurance plan as a dependent are eligible for 2 types of benefits, up to $8,750 in reimbursement of health insurance out-of-pocket expenses and up to $100 per month in premium reimbursement. Alternatively, the providers that are eligible for employer plan as a dependent can enroll into Cover California and receive the fund's Covered California benefit. Question number 6. When can I sign up Where can I learn more? Answer: the applications for the CCPU Fund will be available in early January 2023. Signups to get updated via text or email on www.ccpuhealth.org. Be sure to enroll in a qualified health insurance plan during open enrollment to ensure you're eligible for CCPU Fund benefits. Question number 7. Who can help me enroll in a qualified health insurance plan? Answer: go to www.ccpuhealth.org and find assistance in enrolling the qualified medical plans in both Medi-Cal or Covered California. In order to receive the health benefits, please be sure to enroll in qualified plans as explained above. Frequently asked question number 8. How will I know if I meet the eligibility criteria by being part of a child care subsidy program? Answer: eligibility calculations will be performed in January 2023. Please check with www.ccpuhealth.org for the latest information and updates. In summary, the CCPU Health Care Fund benefits are eligible providers for the healthcare expenses. We will be launching in early 2023 with the benefits effective for claims on or after January 1st. We have something for every eligible provider, whether you're on Medi-Cal, Medicare, Covered California, your second employer, or you don't have health insurance. And it's most importantly for your providers that enroll in Covered California, the Health Care Fund only works with a silver level HMO. Let me repeat that important note. When we are reaching out through open enrollment, it's important for us providers to pick a plan, and that plan for us to be eligible for the fund of CCPU, we must enroll in a silver level HMO plan through Covered California. Please make sure you enroll in a qualified health plan in order to be eligible for benefits, and sign up on the www.ccpuhealth.org to get updates. Finally, please remember that we're here to share things that are great news about CCPU Fund benefits, but the final benefit rules will govern, and you'll be eligible for benefits will be determined when you enroll. I'd like to take the time to introduce Pinnacle, the management company, the CCPU Health Care Fund third-party administrator. Pinnacle will be handling all administration of the Health Care Fund, including eligibility verification, claim reimbursement, customer service, and more. We have Steve, Chief Operating Officer, and Bobby, the Vice President of Key Accounts, here with us to address any healthcare fund questions you may have. So if you have any questions relating to CCPU Healthcare Fund, please submit them in the chat. We will answer as many questions as possible and get back to you if we run out of time.
Thank you, Horace. Hello, everybody. Steve Megafit from Pinnacle. We are as Horace mentioned, we are the administrator for the new healthcare fund, and we're working very quickly to get it up and running. We're very excited to be part of the program with you all. We have a lot of questions already teed up, and like Horace mentioned, you can enter any new questions into the question and answer box on Zoom. So I'll let Bobby go through the questions, and I'll try to share as best as we can the answers that we do know, And then for anything that is we don't have the answers today or we run out of time, we'll be posting information on the website, and we're eager to help you navigate through this new fund. So Bobby, where do we start? What's our first question?
Well, we've got several questions, Steve, as it relates to employer-sponsored plans. So I think we want to go through the eligibility on the employer-sponsored plan. So they're asking, is this like Obamacare? Will the benefits cover my spouse and dependent children?
So the answer to that question, if you remember from the presentation today, this is not replacing your health plan. Obamacare, Cover California is often referred to as Obamacare, and the fund does work in conjunction with Covered California for providers that are on a Covered California plan. The fund only covers reimbursement for eligible providers. It does not cover benefits for your dependents or your spouses. It's only for the providers themselves that become eligible for benefits.
Great. The next question, I think you've answered this, but let's just make sure we're on the same question line, which is, I have health insurance because my husband works and he insures me through his employer. Does he qualify for this plan?
Your spouse does not qualify unless they are an eligible child care provider. But if you are on insurance through your spouse's plan, you can qualify for the benefits under the fund. And maybe we can flip over to page 29. There you go. So if you have access to a plan through your spouse, you can be covered up to $8,750 per year on your pocket expenses. So your copays, your deductibles, your coinsurance, and you can be reimbursed for your share of the cost for being on your spouse's plan up to $100 per month of the premium.
Great. Here's another one along the same lines. I'm a child care provider that provides coverage for my employees. So they have an employer plan. Do I qualify? Do I have any benefits?
Can you read that one to me one more time, Bob?
Sure. They're a child care provider that has their own employer sponsored plan. Do they have any benefits underneath this program?
Yeah, so if you are a member of your own plan as the employer, then you would be eligible under that employer-sponsored plan for that same $8,750 per year out-of-pocket reimbursement benefit and up to $100 of your cost of the premium on the plan.
Great, great. We've got a lot of questions about Covered California coverage, so we want to switch over to that particular slide. I have a Covered California Silver 73. Is this the correct plan to be on?
Silver 73 on Covered California is a benefit level. So the qualified plans in Covered California have to be a Silver HMO plan. So your Silver 73, if it is a HMO, it would be the correct qualified health plan. I believe there are Silver 73s that are not HMOs. Those would not be qualified. So we could take a look at that with you specifically and look at which Silver 73 plan you're on and help you determine if you're on a qualified plan. And if you're not on a HMO plan, we can get you some help during the open enrollment period with a qualified insurance agent to help you change to a Silver HMO plan that will allow you to access the fund's benefits if you're eligible.
So that answers the question for the person who sent the question in. I pay for a PPO through Covered California. Now I need to switch to a Silver plan to get these benefits, correct?
If you're on a PPO, you need to, and you're on Covered California, you need to switch to a silver HMO plan. So if you are not on a silver HMO plan and you're in Covered California, in order to access the fund's benefits, you have to be on a silver HMO. So if you are on a gold plan or a platinum plan, you cannot qualify for the fund benefits. And if you're on a PPO, you cannot qualify for the fund benefits. So we're here to get you in the right hands to help you make those changes to access the fund benefits. And just as a reminder, with that silver level HMO plan and this new healthcare fund benefits, all of your premium cost will be covered and all of the out-of-pocket expenses will be reimbursable.
And Steve, do we want to make a note about the location if a HMO is not available?
Yeah, there are a very few places in California where there is an exception, where there is not a silver level HMO plan available. In those cases, the lowest cost silver level plan on Covered California will qualify. And again, you can reach out to us and we can help you navigate that, but that would be very rare. It's more of the exception than the rule.
Great, thank you. One more question. It's a good scenario, I think, kind of goes with what we were just talking about. If I have a gold level plan with Covered California due to medical needs, will this benefit at least cover part of it up to the silver level?
As the fund is built today, it will not. There is not a process or a rule in place where we can reimburse on a gold plan. It would have to be on a silver level HMO in Covered California.
Great. Here's a question. Will this, and I've highlighted the word insurance, will this insurance help pay for dental care?
No, it will not. The funds, this fund is new, and for the first year, the fund's benefit only reimburses for a qualified medical plan.
Okay. If I pay my own insurance, not through Covered California, am I eligible for benefits?
If I pay for my insurance not in Covered California, am I eligible for benefits? That one we are actually working on. There are a few rare scenarios where someone is not eligible to enroll in Covered California, and the healthcare fund has determined that they will have something for everyone. So there are a few exceptions there that will be evaluated, and there will be a benefit made available. More to come on that.
Great.
Before we jump to the next question, I did want to just make a note. Our website for the healthcare fund, you've heard it a few times today. It's www.ccpuhealth.org. There's also a QR code in the bottom right corner of your screen that takes you to that page. One thing I wanted to mention is that we have the website now available in multiple languages. So you can there's a button on the bottom right of the screen where you can pick your preferred language for the website information.
It's a great reminder, Steve. Thank you.
One more thing too. I see several people with their hand raised in the Zoom window here. I don't believe we have the ability to let you ask your question verbally. So if you could please use the Q&A feature in Zoom, and we will try our best to get to your question.
Great, thank you. This is a really good question. I'm a provider that is retiring soon. Do I qualify for any benefits?
You might. So if we go back to page 15, we have the rules for qualifying for the benefits under the fund. The first one being you have to be paid for work with a subsidized child. Second, you have to be enrolled in a qualified health insurance plan. And then third, you have to apply with the fund. So if we go to the next page, I think someone who has an upcoming retirement, this is probably where your eligibility may come into play. So it's based on being paid for work with a subsidized child. So as you are paid for work with a subsidized child, you would be earning the eligibility for the fund. After you are no longer getting paid for work with a subsidized child, then you would no longer be eligible for the benefits under the fund.
There was a question, Steve, that wanted clarification about what subsidized mean. Are you talking about medically subsidized or childcare subsidized?
It's childcare subsidized. So part of the process that we will do to determine is who's eligible for benefits on the fund. So when we receive your application, we are comparing it against the paid data from the state of California for the work being performed to take care of children that are subsidized with state payments.
Great. Do I have to join the union to receive benefits?
No, you do not.
Okay. If we have more than one provider on a license, do we all qualify for benefits?
If you have more than one provider on a license, the rule for today for 2023 is that only one provider per license can become eligible for the fund's benefits. Patricia, did you want to maybe comment on kind of looking ahead into the future relative to that question?
Yes, you know, this is the beginning of that's a big victory, because that's why we need to join us, become a member of our union, and do your part for actions. Because like I say, this is the beginning, and we are going to fight for more for the future, more benefits, because we deserve. That's why if we have a very strong union with more members, our voice will hear more, and our demands, they will, you know, they're gonna hear us. That's why I ask you to, if you know a provider is not part of the union, invite them and be part of our union. Because if we are united, if you are more, our union is going to be stronger, and more benefits we are going to have. Thank you. This is the beginning, because when we fight, we win. And si se puede, we can do it.
Thank you, Patricia.
So we have several questions, Steve, about eligibility. So we might want to go back to that one eligibility screen that we have where it says, I don't have insurance or Medi-Cal. How do I qualify for benefits? And how do I know what benefits I do qualify for?
It's a great question. So if we can go back to page 15, we can revisit those three rules for becoming eligible for the fund. So there's a rule about becoming eligible based on being paid for work with a subsidized child. And then you have to be enrolled in a qualified health insurance plan. So I believe in your question, this is a person who does not have insurance currently. So what we can do is help you find the appropriate health insurance plan for yourself. And every individual person will have their own circumstances to determine what is the appropriate plan for them. If we can jump to page 51, we are here to help get you connected with the appropriate people to enroll in a medical plan. For Covered California, there are agents ready to help that we've been communicating with that understand the benefits for CCPU Health Fund and the need to be on a silver HMO. And then for Medi-Cal, there are county resources available to help you enroll in Medi-Cal. Similarly, we have resources coming soon to help Medicare eligible providers enroll in Medicare. That link on your screen is also on our webpage. There's a spot to get help enrolling, and we'll be working with the appropriate parties to get you connected to help you enroll in that qualified health plan. If we can go back to page 49, the second part of the question was, what are the benefits if I do enroll in a plan? So the benefits are here on your screen, and they vary based on what medical plan you have. There's 3 categories here of benefits available. There's premium reimbursement, out-of-pocket reimbursement, and other permissible health expenses reimbursement. In general, Medi-Cal's benefit is different than the rest. Medi-Cal is $100 per month for the other permissible healthcare expenses. So if Medi-Cal is the right health plan for you, and you enroll in Medi-Cal and you're eligible under the CCPU Health Fund, you're eligible to get reimbursed for $100 per month for these other expenses. If you remember when Horace reviewed that, it's things like glasses, braces, over-the-counter medications, and so on. For the other types of medical plans, the benefits are here on your screen. Covered California, the fund is reimbursing you up to 100% of your cost of the premium for that silver level HMO, and covering up to $8,750 of your out-of-pocket expenses. One thing that's noteworthy here, $8,750 is the out-of-pocket maximum for the silver level HMO plans on Covered California. So what that really means is the fund is here to support 100% of all of your health plan out-of-pockets on that Covered California plan. That's your copays for your doctor's visits, your copays at the pharmacy, if you have a deductible, if you have a coinsurance. Medicare Benefits, we also reviewed today. It's helping pay for your premium on Part D and Part B, and covering up to $8,750 in out-of-pocket there as well. And then if you are on an employer-sponsored plan through yourself as an employee or through your spouse as a dependent, there is reimbursement up to $100 per month for your share of the premium, and the same reimbursement available of $8,750 for out-of-pocket expenses on the health plan.
Steve, for these plans that have $100 a month benefit, are those going to be sent automatically out to these individuals, or are they going to have to submit for them?
They will have to submit for them. This is a reimbursement plan, so it's not a cash benefit. It is a reimbursement of the expenses.
Have a good question here about how much do I need to pay for health insurance?
How much do you need to pay for health insurance? Really depends on your specific circumstances and what health insurance plan you are enrolled in. The fund is not a health insurance plan. It is a reimbursement plan. So we help pay for your cost of your premiums, and in many cases, 100% of your cost of premium, depending on which plan you're enrolled in, based on the table that we just reviewed.
I have a family childcare. I don't have subsidized children, only private. Do I qualify for this benefit?
As the program is designed, only providers who are paid for work with a subsidized child can become eligible for the fund's benefits. I believe the answer is no.
Okay. What if I had Medi-Cal for most of 2022? Then at open enrollment, I enrolled in a covered California Silver HMO. Will I still be qualified for reimbursement?
Yes, if you, assuming that you are eligible for benefits under the fund, as long as you are enrolled in a qualified health plan, you are eligible for reimbursement. You could change. There was an example we went through earlier today where someone changed from Medi-Cal to covered California. That is okay. Your benefits would be which aligned to whatever medical plan you're on.
So here's another question along the same lines. What happens if I have Medi-Cal now, but once I pay my taxes, I no longer qualify for Medi-Cal? What can I do?
So for those providers that have their income change and they change from Medi-Cal, they need to be enrolled in a qualified health plan. It could be covered California. We have a benefit available uncovered California. You just need to let us know, Pinnacle, know that you have changed medical plans and when you have changed medical plans.
Okay. Looks like we're getting close on time here, Steve. Do you want to take a couple more questions?
Horace, do we have time for a couple more, or should we kind of let you wrap it up?
Let's go ahead and wrap it up. I have a few things, and I want to thank you for all your time and great answers, great questions. It brings me back to understanding without us being in the union, making the changes, the 17-year fight for us providers that fought to unionize. And at the end of 2019, we were able to get Governor Newsom to sign the AB 378 that allowed us to vote and become a union, which gave us the opportunity to sit at the table and win that $1 billion benefits. And this is just one of these benefits. Mind you, is our first contract. So as Patricia said earlier, and as I said earlier, this is one of the first meetings that we're going to come to, as well as this is one of our first contracts. Excuse me. And as we embark on the future, which is around the corner, we are now starting to build our bargaining team and prepare for our second contract. And with that, we are as strong as our unity, our ability to come together. And please don't sit on the sideline and just benefit from all that you have been receiving. And understand this, at the end of the day, if we're all fighting for the same cause, we're all going to be taken care of. So I urge you guys to please join our union. Please understand the fight. Please find your position in what you can do, because we all know someone who knows someone who's participating. But let's make sure we're all doing our work. So this, not just this benefit, but all the benefits that we have won, continue to come and provide more. With that, I want to end our program today. I want to thank you so much for joining us. It is our collective participation that will ensure our professionalism, will continue to protect ourselves, grow, and ensure our healthcare needs are met. Thank you so much for your time and your attention today. And please, again, sign up on the website for further updates and remind yourself, this is the first of many updates that will come. God bless. Thank you.